Hi everyone, welcome to this Alfred Community Forum. We're really pleased that you could join us for our second community forum tonight, and what we're focusing on, as you all know, is fertility. So my name's Michelle Giles and I'll be leading this meeting along with my colleague Kate Stern, who I'll introduce in a moment. Just before we start the meeting, I'd like to acknowledge the Wurundjeri people of the Kulin Nation as the traditional owners of the land from which I'm participating in this meeting. I'd also like to acknowledge the traditional custodians of the various lands from which you all join today, and any Aboriginal and Torres Strait Islander people who are participating in this meeting also. I'd like to pay my respects to elders past, present and emerging, and celebrate the diversity of the Aboriginal peoples and their ongoing cultures and connections to the land and waters of this country. So I'd like to introduce Kate Stern, who's going to be joining me tonight. I'm an infectious disease physician and specialise in immunisation and infections in pregnancy. And really importantly, because we're focusing on fertility tonight, we're really privileged to have Kate Stern, who's an associate professor at the University of Melbourne and the Royal Women's Hospital. She's head of Reproductive Services and head of the Endocrine and Metabolic Service at the Royal Women's Hospital. So Kate brings to this meeting a wealth of experience in relation to fertility and years of experience in looking after and in counselling women who are trying to have a baby. So next slide, Kate. Thank you. So I know we're focusing on fertility tonight, but I wanted to provide some context to the discussion around fertility and COVID vaccines, and in particular I wanted to talk a little bit about pregnancy. I know that many of you have joined tonight not because you are pregnant, but you may be thinking about pregnancy in the future, you may be thinking about pregnancy now, you may be trying actively to get pregnant. And I think it's really important when we think about COVID and vaccines, the whole point of the COVID vaccine is to protect us against infection. And if you are interested in fertility and the extension, the natural extension of that, which is pregnancy, I think it's really important to understand how severe COVID can be to pregnant women. So I've just got a snapshot of some of the recent reports that have been in the media around the concerns that we have about pregnancy and COVID. And for any of you who are working in the healthcare system now, this is real. I updated my figures today, and over 10% of the current inpatients in one of our tertiary hospitals in Melbourne, 10% of those inpatients are pregnant women. So this is a real issue. Next slide, Kate. So there's concerns amongst young people, and many people, I think, without knowing the ages of people who've signed up today, are young people if you're worried about fertility and COVID, and will end up in ICU, and so will many pregnant women. Next slide. You can see this is another headline just to make sure that everyone's aware. This was recently Victoria, and everyone knows our cases are on the increase, but what we're really particularly worried about is with all those cases, an increase in cases and infections among pregnant women. So the goal really, if you're not pregnant, is to try and protect you now against COVID so that you don't end up really sick if you do happen to be pregnant in the future. Next slide. And this is a real story. Last year I was involved in looking after a woman who was in the intensive care unit. She's very close to dying. Her twins had to be delivered early, and I'll talk about the risks, but this is real. Pregnant women often end up in the intensive care unit, and we have to make decisions about whether to deliver their babies earlier than we otherwise would to save the life of the mother. Next slide. So I just wanted to provide that context, and now I'm going to go on to talk a little bit about mRNA vaccines and how they work. And the reason I want to do this is because one of the frequent questions that I get asked is the frequent concern, if you like, that people express when they worry about the impact of vaccines on fertility is what the vaccine does to their reproductive system, what it does to their reproductive organs. And I think that it's really important to understand how the vaccines work because they don't actually reach your reproductive organs, and I'll come to that. So the mRNA vaccines. So let's start with what is mRNA. So the M stands for messenger, and the RNA, the way I think about it, is it's a set of instructions that helps to tell your body how to make a protein. So if you like, the core part of the mRNA vaccines, which is the Pfizer vaccine or the Moderna vaccine, is this set of instructions. Next slide. So that set of instructions is then contained, if you like, in a coating. And that helps to deliver that set of instructions. And as you know, the vaccine is given into the muscles of the arm. So into the muscle cells in the arm is this vaccine is injected. Now, it's really important to know the vaccine doesn't contain any virus, so it can't give you COVID. And next slide, Kate. And so when it's injected into the muscle cell, what happens is that set of instructions tells the cell how to make the protein, and the protein that it tells the cell how to make is called the spike protein. And what happens is once it's told the cell how to make that protein, that mRNA is actually broken down there in the cell. So the vaccine doesn't get into your blood system and then circulate around your body and go to your reproductive organs. It doesn't go to a placenta if you're pregnant. It doesn't go to your ovaries. And the mRNA is broken down, and it's broken down so it also isn't incorporated into the DNA. So a lot of other theories that have been proposed is that the mRNA can be incorporated or change your DNA, and that's actually just not possible. And what we do once our body sees that protein that we've made is we make antibodies. And then those antibodies are what protect us if we get exposed to COVID in the future. Next slide. So just some very quick commonly asked questions. So I've heard this a lot. Given how quickly these vaccines have been developed, how do we know that they are safe? So I think it's really important to reassure everyone listening that actually these vaccines have undergone the most intensive safety monitoring of any vaccine in history, and they undergo exactly the same rigorous review by the TGA as other vaccines. So there hasn't been any cutting corners. And there's actually a well-established different phases of clinical trials that are used for all sorts of medications and vaccines. And you may have heard of them. They're phase 1, phase 2, phase 3 studies. There's animal studies is often what's started. And then there's those phases often happen sequentially, but in the pandemic what's happened is they've overlapped. So they haven't been skipped, none of them have been missed, but they actually have occurred in an overlapping fashion that means that we get the information much more quickly than we otherwise would. So are mRNA vaccines new? And I understand that lots of people are actually a bit concerned about getting a vaccine that they perceive as being really new and really new technology. So in fact, mRNA vaccines aren't new. The COVID vaccines are not the first mRNA vaccines that have ever been used. So whilst there's no mRNA vaccine that has had a worldwide implementation like we've seen with the COVID vaccines, mRNA vaccines have been given to humans for at least 4 other infectious diseases. And many of these you will have heard about: rabies, influenza, cytomegalovirus, also known as CMV, and Zika. So mRNA and vaccines, COVID are not the first time that we've ever used this technology in making vaccines. So, do COVID vaccines cause infertility? So I'm starting with essentially a statement from the TGA. So the TGA, the Therapeutic Goods regulator. It's the main regulator who is responsible in Australia for registering every product that we give to people in terms of drugs and vaccines and medications. And they review before a vaccine or other drug that we're allowed to give to people. The TGA review all the evidence, and particularly not just whether it works, but also the safety data. And they review safety data from a number of sources. So the safety data from clinical trials, the safety data from pre-clinical animal work, and then they also can review post licensing or post-registration experience from other countries. And what they've reported, what the TGA's advice clearly is with COVID vaccines, is that there's no scientific evidence to support that COVID vaccines cause infertility or have an impact on infertility. Now, I think what I'm hoping to do tonight is to present that in a little bit more detail, and Kate will certainly speak to that in a little bit more detail as well, because I understand by talking to lots of individuals who have questions about infertility that sometimes you just want a bit more detail than us, as experts saying it just doesn't cause any problems. So what I hope that you'll get out of tonight is that we will address some of the really common questions. We'll provide you with the science and the evidence to answer those questions. Hopefully we'll answer all of your questions if we can in the chat at the end, and really provide you with the answers and the information based on science, and based, not theories, but actually based on science and evidence, to help you make your mind up, if you haven't already, about receiving a COVID vaccine. Next slide. Okay, so I am going to address this first question about COVID vaccines and whether they affect pregnancy, recognising that this is on fertility. As I mentioned, we've already talked about how severe COVID is in pregnancy, and I think it's really important to keep that in the front of our mind. Why, if people are planning or trying to get pregnant, why do we want to protect you? So next slide. So this is the most up-to-date information that we could possibly get, really. It's been publicly published at a presentation. The ACIP is like the American equivalent of an expert group on immunisation, a bit like ATAG in Australia. They advise about safety and recommendations for using vaccines. And this meeting, which occurred only a couple of weeks ago, had an update on COVID and pregnancy and the safety of vaccines. Next slide. So to summarise, because I've already mentioned this, this compares pregnant women with COVID with non-pregnant women of a similar age at the top, and underneath it compares pregnant women with COVID versus pregnant women without. And what you can see is that for almost every single outcome for severe disease, if you are pregnant and have COVID, you are more likely to end up in ICU. You're more likely to need a tube down your throat to help you breathe. You're more likely to potentially have a preterm birth, stillbirth, or your baby be admitted into the intensive care unit. Next slide. And actually, in the interest of time, this presents a similar sort of data about severe illness and death. Again, is much more likely if you're pregnant than non-pregnant. Next slide. So do the vaccines work to protect against this? It's really important. If we're recommending that you have a vaccine and because you're more at risk of severe disease, we want to know that the vaccine we're giving you is going to work. And pregnant women weren't in the original trials of vaccines, but this is some nice data that has just been published that compared 10,000 vaccinated pregnant women with 10,000 unvaccinated pregnant women. And what the graph on the right shows you is that you are more likely to get infected if you were unvaccinated. And we've seen this now. This is playing out in every single day. Those numbers that you see reported in Victoria of cases, the majority we're seeing are in unvaccinated people. So it absolutely makes you more vulnerable. And I've already mentioned the consequences if you're pregnant, potentially. Next slide. So is it safe? These are the preliminary findings of all the mRNA vaccines given. This is from the United States. Next slide. This was initially presented in April, and this was, you can see, this was follow-up data for almost 20,000 women who received Pfizer and 16,000 who received Moderna. Next slide. And basically what this shows you, and anyone can access this article, is that you weren't at increased risk of stillbirth or abortion. And this was for about 827 women. Next slide. And what I wanted to show you here is that of September, but many women say, well, that's not very many that they've followed to the end of their pregnancy. And so what has been recently published is a doubling of that. So now 1,600 pregnancies have been followed, and essentially it's confirmed the same information, which is you're not at increased risk of adverse pregnancy outcomes if you're vaccinated during pregnancy. Next slide. We'll move on. That's exactly the same as I've just explained. Excellent. I just wanted to rush through that so I can get to Kate. So I'm going to try and talk a bit less now. And so I might throw to Kate to talk about these questions specifically on COVID vaccines and fertility. Thanks, Kate. Do COVID vaccines, Kate, affect fertility?
Okay, thank you, Michelle. Spoiler alert, no, they don't. So thank you so much for asking me to be part of this group tonight. It's so important, as you say, for patients and our patients and people in our community who are considering pregnancy, really want to be able to get the most information they can rather than just being told by us. And so I really appreciate the opportunity. As with you, every day, lots and lots of patients say to us, I'm just so worried, I don't want to have the vaccine. You know, how do you know it's safe? And it's so important to be able to have this opportunity to hopefully reassure the community, because we are really very convinced that COVID vaccines do not affect fertility. When we talk about fertility, there are so many different aspects of fertility. There are the eggs, there are the sperm, there's the lining of the uterus, there's a whole lot of luck, there are factors in the embryo. Fertility is very complicated. But the initial work that has been performed looking at fertility generally has been in animal studies, and it's been very rigorous work done with very high doses of vaccines, far greater than the normal human dose, which have been done in animal studies. And I'm very reassured that a multiplicity of studies, several studies with large numbers, have shown, when looking at all sorts of aspects of fertility, they look at the lining of the uterus, the sperm, the eggs, embryo development, the ability of the embryo to withstand the early pregnancy and stay in the uterus. And these studies have shown absolutely that there's no evidence of what we call reprotoxicity or damage to fertility or an embryo in the early stages. And this is very reassuring data.
Thanks, Kate. I think I've got a few other slides with some questions coming up that might explore that in a bit more detail. Yeah, great. Next slide. So for those of you who have tuned in, if you want to not just believe what Kate says, but we've also included some references from other international researchers that confirm exactly what Kate has suggested, that there's no evidence vaccines can affect fertility, and there's new guidance around that. This is a paper, just one example, that was published in the British Medical Journal this year. Next slide. So Kate, can you tell us, you've mentioned all the different aspects of fertility, so I'm really keen for you to go into a bit more detail about specifically ovaries, and then I think we're going to move on to sperm.
Yes, absolutely. So it's really important to understand that these vaccines do not have any impact on our egg quality and our egg number. Egg quality and egg number are the most important factors, particularly egg quality, on the likelihood of success with spontaneous fertility and with fertility treatments. So how good our eggs are is the most important parameter for fertility. And there have been several studies in the laboratory situation, in animals, and more recently in humans. And in one of the most recent studies in humans, the follicle fluid, the fluid that surrounds the egg in the follicles in the ovary, these are the eggs that are going to ovulate, has been evaluated in women that have had the disease, in women that have had the vaccine. And it's very enlightening and reassuring to know that in women that had vaccines, there was no impact on the quality of the eggs or the fluid which has the hormones in it. So the vaccines are not affecting the hormones which act on the eggs, and they're not affecting the genetics and the cells around the eggs. So I think we have good data to be able to say that COVID vaccines do not affect egg quality. It will take years to know exactly about egg number, but all the initial data is very reassuring to say that COVID vaccines do not affect our egg numbers or the fact that eggs can then be fertilized by the sperm. It's very reassuring.
Yeah, and I think importantly to add to that, Kate, is that biologically it's not really plausible that a vaccine that is injected into the muscle cells and is broken down in the muscle cell could then, without reaching the ovaries, cause a
That's right.
problem with the eggs, right?
That's right. So the studies are looking at antibodies, and there are studies looking at the infection. There are studies looking at the women who had been vaccinated and the antibody responses, and it was all extremely reassuring. As you say, Michelle, when you look at how the vaccine works and the fact that it's broken down, what we're analysing is the result of the vaccination. It's not the vaccine itself.
Excellent. So the next slide, Kate, I had was asking about sperm. And, I think if anyone's been following social media, there's been a little bit of coverage recently about potential adverse impacts on male aspects of fertility. And I think that's really important because we tend to think about and focus on certainly a lot of the people that I get asked questions from are females, but I think that there is some concerns out there around the potential impacts on male fertility as well.
Yeah, that's right. And it's our female patients who are asking about their sperm from their partner's point of view. Maybe they're too shy to ask us.
Yeah.
So one of the good things about sperm, well, there's lots of good things about sperm, but one of the good things about sperm is that it's easy to assess. Sperm is, very prolific. We can do a lot of research looking at sperm. It's much harder to evaluate eggs than it is to evaluate sperm. And let's just remind ourselves that there are now multiple studies showing that COVID infection affects sperm. It can affect concentration, it can affect motility, and there is a little bit of work suggesting it can affect how the sperm look. Now, it hasn't been really long enough for us to assess if that's something that lasts for years, and it is most likely to be a temporary phenomenon. But even in men who do not have severe COVID, there are effects on sperm from the infection. Fortunately, there are now multiple studies looking at how the vaccines or the effect of the vaccines impact on sperm. And there is no evidence of any reduction in sperm concentration or reduction in the good sperm, the motile sperm concentration, the best sperm. And there is no evidence that it affects the way the sperm look. Interaction of the sperm into the egg is harder to establish, but there is some animal work showing that there is no impairment of the sperm getting into the eggs in an in vitro lab situation. So I think that we can put those rumours to rest now, that we are confident that there is no negative impact from the vaccine on sperm production, quantity or quality.
Excellent. Hopefully that reassures any males and females out there who are worried about sperm. So as I mentioned earlier, I've just got a couple of slides again. If people are watching or listening and want some actual references to look at that support some of the things that we've said, there's one here that looks at male fertility and particularly what Kate's alluded to, the quality of the sperm, and again, doesn't show any impact in concentration or the other parameters. Next slide. Okay, so this is really topical as well, Kate, and I'm sure you've been asked lots of questions about this. And so since the COVID vaccines were introduced, there have been reports that some women have experienced changes in their menstrual cycles. And so I thought this would be a good thing to discuss if you wanted to talk about what your thoughts are around COVID vaccines and menstruation.
Yes, thank you, Michelle. This is a very important topic and it's good to be able to discuss it. It's interesting that in all the original studies, there was no specific analysis of the effect of vaccination on the menstrual cycles. And we need to remember, however, that there is some good evidence that actual COVID infection affects menstrual cycles, probably temporarily, but that can disrupt menstrual cycles. And the most recent studies suggest that over 25% of women will report disruption of their cycles after having the disease. Now, when we go to vaccines, again, the vaccine studies, as we said, were not really assessing menstrual cycles. And again, as you say, there have been reports, but there is not scientific evidence about the frequency of the vaccine affecting the menstrual cycles. It's really case reports, signals, and I guess it's reassuring that things get signaled, and so then we can investigate them further. And let me say that there's been a signal, there are sort of anecdotal reports that the vaccines can affect the menstrual cycles, and now there's a big grant in the US, and we're about to commence a study in Australia further evaluating whether these vaccines have any impact on the menstrual cycle. Now, the reports that we have, these sort of ad hoc anecdotal reports, suggest disruption of the cycle in all the vaccines, not just the mRNA vaccine. So I think that's important from a biological point of view when we're thinking, oh, is there something in the vaccine that's actually affecting the cycles? So the reports have come from the AstraZeneca vaccine as well as the mRNA vaccines. And what we hear is the signal is that cycles could be disrupted for 1 or 2 cycles. Now, in some reports, it's happening in 0.3% of vaccinated people. In a US study, it suggested it was a bit more frequent than that. So it's not particularly frequent, but it's not impossible that it actually does happen. And it's a bit like when you have the COVID vaccine, like when you have your influenza vaccine, it's possible that you're going to get some reactive changes in the lining of the uterus. These are not changes that are going to affect the lining of your uterus and its ability to carry a pregnancy. There's been very good study done on this, as I mentioned before, but it's not completely out of the realms of possibility that we're getting these sort of reactive changes like we do when our arm hurts or we get just feel a bit tired. But at worst, it appears to affect maybe 1 or 2 cycles, and it does not persist. The other thing, I guess, is that there are lots of factors at play in our menstrual cycles. Anyone who's been stressed or busy or not been eating properly or changed their exercise can attest to the fact that this can affect our menstrual cycles. Our cycles are very, very sensitive to everything that's going on in our lives. So I think that we can't say that the vaccines do affect the menstrual cycle, but we can't say they don't. But what we can say, and this is important, is that any effect is a temporary effect. It's not a serious effect. It's not a pathological effect. It's not actually changing anything significant in our bodies. And it could just be the effect, just on the immune cells temporarily as part of the reaction to the vaccine that's helping make the antibodies. So I think it's really important to stress that, we're going to do more work on this. And this is an example of the signalling in the big studies, the fact that in these huge population studies now, we can get, it's a bit of background noise, and then we can look at it really scientifically now.
Thanks, Kate. So I think one of the things you said that I hadn't completely thought through, that outside of COVID vaccination, many women have changes in their menstrual cycles for short periods of time with different things happening in their life, but it doesn't have a long-term effect, doesn't reflect necessarily any long-term problems with their fertility. It's just a change that occurs due to any number of factors. And so that could be what we're seeing here, although we need more information. Is that
yeah, absolutely.
Sort of mean? Okay.
Yeah, absolutely. It could possibly be a reactive change, but it's not pathology. It's nothing bad. It's just something that's happening. And there are lots of factors at play in our menstrual cycles. Stress is a very big part of that.
Okay, and there's lots of reasons for people to be stressed at the moment.
Just say lockdown, more and that's all you need to say.
Yeah, I've got it. Next slide. Okay, so this is a really important question, and I'm glad you're here, because for someone who works day in, day out in the IVF world, you would get this question all the time, but we also get this question, I'm I get this from people who are about to start IVF. They're maybe already on having cycles of IVF and really trying to work out, should I get the vaccine? And if I should, when should I have it? And does that make a difference to my treatment or my cycle? So I'd love to hear your thoughts on this, Kate.
Yeah, so as we said before, fertility is quite complicated and there are lots of different factors. So our discussion prior to this particular question relating to the eggs and the sperm and the menstrual function and early pregnancy are all really important and actually feed into the answer to this. So again, the evidence so far suggests that these vaccines, or the effect of the vaccines, does not affect IVF success. So first of all, we have the animal studies, which have looked at eggs and sperm getting together, fertilizing, how many eggs in the animal studies the animals got, how well they fertilized, how well they implanted, and then subsequent embryo development. And there are huge numbers, in the thousands of subjects in those studies. And there are now 3 studies, clinical studies, in people who have had IVF treatment. And they're all, I'm not going to go into too much detail, I'm happy to supply the references later, but they've all looked at different things. They've looked at patients that were, one study looked at patients that were vaccinated compared to patients who had previously had COVID, compared to people who had neither. And they looked at clinical pregnancy rate and early miscarriage. And in that study, looking at those 3 different groups, there was no difference in the outcomes. And when we say outcome, we're talking about an early pregnancy with a fetal heart, what we call an early clinical pregnancy. So that was very useful comparing. So as people that had long recovered from COVID versus those who had the vaccine, often very recently, versus control patients, and there was no difference. So that was very reassuring. There are also other studies that have looked at patients before and after they've had their vaccinations to see if there's any difference in success rates. And again, reassuringly, there has been no evidence of any difference in things like egg quality, egg number, fertilization, and most important for our patients, clinical pregnancy. And even more importantly, in terms of miscarriage, no increased risk of miscarriage. As we said before, there's no biological reason to think there would be, but it's very reassuring. Now, of course, we've only been doing these studies for the last year and a bit, and so it's going to take more time. But the fact that all the studies that have been performed have been so reassuring and so scrutinised, this has been such a scrutinised area, and it's with all aspects of COVID, but it's reassuring for our community that there has been so much scrutiny. So we can be really confident at present that the effects of the vaccine will not affect success. In terms of the timing, everyone's always worried about, should I have it before I start my cycle? What would happen if I have it when I've got an early embryo? All that sort of stuff. Now, we know that some patients get side effects from the vaccine and they feel a bit miserable for a couple of days. That is not going to affect the success of your treatment. So the only decision that you make really is if you are worried about being unwell for a couple of days, even though being unwell for a couple of days is not, at worst, and we know it's very, very minor, it's not going to affect your fertility treatment. So really our advice to patients has been, just have the vaccine, just have the vaccine. Don't worry about where you are in your cycle. We're not worried about your eggs and the sperm in the embryo. We're not worried about embryo development. Have your vaccine. And so we're not just saying that in an empty fashion. We're saying it with a reasonable degree of evidence now.
Yeah, and I think the other aspect, Kate, that I often talk to women about is this issue of optimizing your health before you get pregnant. So one of the best things you can do for your baby is to make sure that you are as healthy as you can be before you actually get pregnant. So that might be, if you've got another medical condition like diabetes, you might want to maximize your control of your blood sugars, for example. If you, and I guess the natural extension of that is, given that COVID in pregnancy is bad for mums and bad for babies, then before you get pregnant, if you can get that protection, you're maximising your health before you are potentially pregnant.
Absolutely, absolutely. Like with everything else, all your environmental risks. But equally, I guess we don't want people to wait too long, particularly as they get older, because they're worried about having the vaccine just as they are having their treatment. We don't want them to think, oh, I've got to have my vaccine and then I've got to wait another 6 months, because there's good evidence that it's not going to have any adverse effect. But yes, it's all part of getting to be as healthy as you can when you're wanting to conceive.
Yeah, and I think that's a really important point, actually, that there are no guidelines anywhere in the world that suggest you need to wait after the vaccine before you try and get pregnant.
Absolutely. There is, as you said before, there is no live virus in this vaccine. So we know with rubella vaccine, we say to our patients, look, wait 6 weeks, but it's a completely different situation. So it's important to stress that the vaccine has no virus. It's not going to affect your IVF treatment or your early pregnancy.
Excellent. Thanks, Kate. I think we've only got 1 or 2 more slides, and we've got a few questions in the chat. So
yeah, this was just one of those. This was just one of the studies we're looking at patients that had treatment before and after. It's one of the studies that I alluded to.
Perfect. So the answer is, I think it's pretty, you started with this. I don't know if we needed this slide, but does it affect fertility? So the key message is, this is our last slide, and then I think we'll try and address some of the questions in the chat. Do pregnant women get more severe disease with COVID? The answer is yes, and I've presented some data that shows that. Does mRNA enter eggs or sperms? The answer is no, and we've got data for that. Do COVID vaccines affect fertility? No, we've talked about that. Should you get a COVID vaccine if you're pregnant? Yes, and there are some questions in the chat I'll come to. Are COVID vaccines safe in pregnancy? Yes. And we haven't talked about this, I won't go into this in detail, but should you receive a COVID vaccine when you are breastfeeding? The answer is also yes. Okay, so let's move on to some of the questions. If you can stop sharing, Kate. So one of the first questions that I'll start speaking to, if you like, is it safe to have COVID vaccine at any point during pregnancy, including the first few weeks? And the answer is yes. So all the recommendations say that you can get the COVID vaccine at any trimester. The safety data that I presented included women who were given COVID vaccine pre-pregnancy at the time of conception, first trimester, second and third. Probably, though, when you think about the time of most severe disease, it's actually in the third trimester. So we really would like pregnant women to be protected, if not before they go into pregnancy, by the second trimester, when they can experience those severe outcomes and that we mentioned. So are there any risks to the unborn child of the vaccination? So there aren't. The studies have looked at things like abnormalities in the baby. They've looked at things like preterm birth, stillbirth, and the vaccine isn't associated with any of those things. But importantly, COVID infection is. So in fact, we're trying to prevent risks in an unborn baby like preterm birth and stillbirth by protecting women from getting COVID. Kate, there's a question in the chat around teenage girls and them starting periods and haven't had a vaccine, and whether anything changes, I guess, with what you alluded to with eggs and menstrual cycles if you're a teenage girl versus if you are, I don't know, 22-year-old woman.
So I think when you're a teenage girl, if we can remember back, like yesterday.
Not well.
You know, you'll remember that the first 3 or 4 years when you have your periods, it's really quite variable what your cycles are like. They can be erratic, they can be episodically painful or not. You might miss some periods. So the first few years of having your periods are very variable. Now, there is absolutely no reason not to have the vaccine in the early days. And it's also very important not to then assume that the vaccine is causing the disruption and to worry about it. Now, it's going to take years to get more information about this, but there's no evidence so far that it causes ovarian cysts or it mucks up your cycle more than, as we said, just a little bit temporarily. But I think it's just we have to expect the variability for young girls starting their menses, as we always have. It's not related to the vaccine.
Excellent. Thanks, Kate. I might take one of these questions on being vaccinated and the protection that might give to the baby. So what we know is that as I explained, when you're vaccinated, you make antibodies, and we know that antibodies cross the placenta. We actually sort of utilize that, if you like, in this with influenza and whooping cough vaccine to protect the baby. We know for COVID vaccines, we've found antibodies in breast milk, and we've found antibodies that cross the placenta and go to the baby. Now, that's not the virus, it's not the vaccine, it's not the infection. That's actually the protection that if your baby then gets exposed to COVID, they may have some protection. We clearly can't vaccinate and protect our newborns. So actually, vaccination during pregnancy, if it's needed to protect the baby, this is the only way you could do it, is getting vaccinated when you're actually pregnant. So other questions, Kate, there's a question actually here about having endometriosis or a history of endometriosis, and would you expect that to make you more sensitive to the vaccine? I'm not sure if sensitive means maybe side effects or symptoms from the endometriosis, but did you want to tackle that question?
Yeah, there haven't been any big studies looking at the pattern of endometriosis in women who and the impact of that from the vaccine. As you know, endometriosis is a long-standing chronic condition. It affects 15 to 20% of women, and most of the women that have it quite mildly, and a small percentage unfortunately have it quite severely, where pain and menstrual dysfunction and heavy painful periods are common. There's no reason to think that it's going to make your endometriosis worse. I'm not sure if that's exactly the question, but that would be a common question and something that's important to know about. But given the stuff that we've been talking about and the effect that any impact on the cycles, while we can't be sure is not major, there is no evidence to think that the antibody response, your immune response to the vaccine, is going to affect endometriosis whatsoever. I know where it's coming from, because endometriosis may have some immune mediation, some immune sort of factors in the cause. It's a complex condition with lots of different factors involved, but we would not have any concern that women who have endometriosis should worry that their disease is going to be significantly altered.
Great. There's two questions here that I might tackle. One is why has advice about vaccines in pregnant women changed in the last 3 months? And I'm can clearly explain why that's the case. So when the first clinical trials were done of these COVID vaccines, pregnant women weren't allowed to be a part of those. So when countries were thinking about recommendations, so the initial recommendations in Australia were that it shouldn't be routinely given because we didn't know enough about COVID and pregnancy, and we didn't have enough safety data. But it could be given still to women who may be pregnant and at high risk, so healthcare workers, for example, or if you had other conditions like high blood pressure, diabetes, that would put you at risk of more severe disease. And then what happened in about June is we got a lot more scientific information that I've sort of summarised tonight about just how bad COVID is for pregnant women. So all of a sudden, pregnant women went from just being the same risk as everyone else to much greater risk, much more likely to go into the intensive care unit. So the priority to protect them was more urgent, and at the same time we got heaps more safety data. So not only did we know we had to do something to protect pregnant women, but we had the safety data to reassure women that it's safe to be vaccinated. So that is why the change occurred, because we had information that became available. Now, it kind of relates to another question in the chat, which I'm happy to take, and it's around whether the advice is the same for AstraZeneca as it is the mRNA vaccines. Now, we haven't really talked about AstraZeneca tonight, and that's because most of the vaccines that will certainly the preferential vaccine recommended in pregnancy has been the mRNA vaccines. That's what we have the most data on in terms of safety, and also for a lot of the fertility studies that Kate was alluding to, they represent the mRNA vaccine. So I think it's honest. The honest answer to that is we don't have the same level of information about AstraZeneca vaccines as we do for mRNA vaccines. That doesn't mean that they're not safe, and in many countries they're actually being given very widely to pregnant women and to women of reproductive age. But if you ask me to show you the equal amount of evidence for AstraZeneca in fertility or pregnancy, we just don't have that information yet.
And just to say, Michelle, that it's amazing how much data has come out since June this year. So in that question about, why is the advice changing? It's because there have been so many studies that have been published, good studies with big numbers in the last 3 to 4 months that are informing the information we're giving tonight.
Yeah, so we're almost at time. I'm just going to try and squeeze in 1 or 2 more questions. One question we get asked about the long-term safety, long-term effects, and clearly we don't have that. COVID hasn't been around long enough, neither have the vaccines, to be able to tell people what are the effects of these in 2-3 years' time. But what I remind people is this is a pandemic, and that if we wait for those long-term effects, people will die, and many pregnant women may end up in the intensive care unit unnecessarily. So that is true, we don't have the long-term effects, but I guess our priority now is to protect people and to keep people as healthy as possible. Holly, we're at time. I'm not sure if we have to finish now. There's still a few more questions. There's one important question in the chat: extreme adverse reactions to vaccines like myocarditis. There's no evidence at this stage that pregnant women or women, actually, with the data we do have, is that men are more likely to get some of those rare side effects like myocarditis, much more commonly in men than in females, and we haven't seen an increased signal of myocarditis in pregnancy at this stage. There's always more questions than what we have time to answer, so I'm really sorry for people who've attended and we haven't got to all your questions, but hopefully we covered off on the really frequent things that we get asked, the really common things and concerns. And I'd really like to thank the Alfred for organising the forum, for everyone for coming, for Kate for joining me. I talk about vaccines day in, day out, but it was so nice to have someone who actually can confidently talk about fertility, eggs and sperm to address this topic. So thanks everyone, and hopefully we've been able to answer your questions and provide you the information you need. I hope you have a good night.